Hello guys, my name is Arvind Ravindra Shinde. My today's topic is a drug acting on skin and mucous membrane. Fact about skin. Skin is the largest organ of the body. It is a very important protective layer of the body and also important for the thermoregulation, biochemical synthesis and sensory functions. This is the structure of human skin. It consists of epidermis, derma, hypodermis and muscles. Skin preparation. There are various types of skin preparations are present. There in which first one is the demulcent, second one is the absorbent and protective, third one is the astringents, and fourth one is the irritants and counter irritants. Demulcent. Demulcent are the inert substance which soothe, inflame or denude the mucosa or skin by preventing contact with the air or irritant in the surrounding. Example of demulcent are glycyrrhiza. It is a sweet fasting root. Mulethi in cough and lozenges to soothe the throat. Methyl cellulose, synthetic cellulose derivative. It is act as a bulk purgative. Eye nose drop, also used in a contact lens solution. Glycerin. Glycerin is a clear, sweet, viscous liquid, dehydrating property, and it has a rectal suppository to induce evacuation. It is applied to the dry skin and cracked lips, 50% in water as a cream and soap. It acts as a emollient and is a popular vehicle for gums and throat and pains. It is used orally per rectum 50 to 75% or intravenously 10% to reduce intraocular or intracranial tension. Adsorbents and protectives. Adsorbents are finely powdered and inert insoluble solid capable of binding to their surface noxious and irritant substance. They are also called as a protective because they afford physical protection to the skin or mucosa. Other protective form a continuous adherent and flexible occlusive coating on the skin. Demulcent and emollients also serve as a protective. Magnesium or zinc stearate. They have very smooth surface, prevent friction, and are not water vaporable and can be used on exuding surface because they allow evaporation of water and do not form crust. Talc. Talc, it is a native hydrous magnesium silicate which is spread easily. Used in phalcum or face powders. Entering rare surfaces, it can form granulomas. Should not be sprinkled on water, sprinkle on wounds, or use for surgical gloves. Calamine. Calamine, it is a native zinc carbonate, finite pink with ferric oxide. Calcined calamine is a zinc oxide. It has a mild astringent and antiseptic property, and it is a good soothing and protective agent. Using calamine lotion along with the zinc oxide and bentonite, which have similar properties. Starch. It is used for dusting powder and for surgical gloves, but should not be used on exuding surface because it is adsorb moisture, crust on drying and encourage fermentation. Boric acid. It is a smooth and fine powder, has a mild antiseptic, antipyretic and deodorant action. It is a common ingredient of prickly heat powders. Aloe vera gel. It is a mucilaginous preparation from the fleshy leaf of aloe vera plant with a smoothing and moisturizing property, widely included in cosmetic and skin care product. Therapeutic claim in the acne, cirrhosis and many other conditions has been made. Polyvinyl polymer. It is when allowed to dry and its solution form a occlusive pellicle-like coating on abraded skin. Used as a spray on abrasion on minor cuts. It protects from dust and exposure. Astringents. Astringents, they have substance that precipitate protein but do not penetrate cells, thus affecting the superficial very layer only. They toughen the surface, making it mechanically stronger and decrease exudation. Tannic acid and tannins. Tannic acid is present in many plants but generally obtained from nutgalls of oak. Tannins are found in tea, cashew, nutmeg, areca nut, etc. They denature protein, forming protein tannates. Uses. Bleeding gums as a glycerin for tannic acid, bleeding piles as a tannic acid suppository. Alcohol. Ethanol and methanol are good astringents at 50 to 90% of concentration. Denatured spirit rub on the skin prevent bed sores. but should not be applied on the source once they have formed, as it is highly irritant to raw surface. Ethanol is usually used as a abrasive and minor cuts. Irritants and counter-irritants. Irritants stimulate the sensory nerve ending and induce inflammation at the site of application. Depending on the nature of concentration and the sensitiveness of the site, they produce cooling sensation or warmth, pricking and tingling, hyperesthesia or numbness, and local vasodilation. Irritants which cause local hyperemia with little sensory component called rubefacient. Mechanism of counter-irritant. Cutaneous sensations are precisely localized. A spinal segment receiving afferent impulse from the surface as well as from the deeper organs modulate they preferentially, conducting the former to the higher centers. When counter-irritants apply to the area of the skin, apply a nerve from the same segment as deeper organ from which pain impulses obscure the deeper sensation. Irritation of the afferent nerve ending produces arterial dilation in the adjoining area of the skin and axon cerebralis. Though through segmental association of different vasodilation also occur in the corresponding deeper organ. Increase in blood supply help to fight the cause of pain and inflammation in the deeper organs. Counter-irritants are generally massaged to relieve headache, muscular pain, joint pain, etc. Counter-irritants and irritants. Volatile oils. They are terpenes, hydrocarbon of plant origin having a characteristic odor. They have variable properties but all are irritants. Example, terpene oil. Mustard seeds. It contains glycoside syngrin and an enzyme myrosin. When ground seeds are soaked in water, myrosin hydrolyzes syngrin to release allyl isothiocyanate, which is a strong irritant. Mustard plaster has been used as a rubefacient and counter-irritant as a suspension in water. 48 grams of ground seed emetics. Capsicum. It is the power of full irritant, hot in taste. The active principle is capsaicin. It is a popular condiment in India cooking. It induces some counter-irritant preparation. After initial stimulation, capsaicin depletes different nerve ending of transmitter substance P may relieve the pain. Methyl salicylate. Methyl salicylate is a contrast to other salicylate. It is not used internally. It combines with other irritant in liniments and ointments for muscle and joint pain. Tryptone is the alcohol. It is a produce rubefaction when rubbed on the skin and vehicle for liminants. The MCQ parts. First MCQ. Which of the following drug classes is commonly used to treat skin condition and act on the skin membrane and mucous membrane? First option is the antibiotic. Second option is analgesic. Third option is hypersensitive. Fourth option is antacid. Second MCQ. Which class of drug commonly used to relieve itching and inflammation of the skin? First option is the antihistamines. Second option is antacid. Third option is anticoagulants. Fourth option is antidepressant. Third MCQ. What type of medication is often used to treat heartburn and acid reflux by acting on mucous membrane of the digestive tract? First option is the antibiotics. Second option is antiviral. Third option is a proton pump inhibitor, and fourth option is steroids. Last MCQ. Topical corticosteroids are frequently used to treat skin conditions. What is their primary mode of action? Then first option is killing of bacteria on the skin. It reduces the inflammation and suppressing the immune response. Third one is the promoting the skin cell growth, and fourth one is the blocking pain signals to the brain. So guys, these are the answers of MCQs. Okay, thank you. Bye bye.